Hi guys, how are you guys? I'm talking today. I'm alone, and I'm talking on behalf of for beating hearts. I am now talking about common heart diseases. If you do not know me, I'm Dr. Betty Teh. I'm a consultant cardiologist, and heart disease, as you know, is the most common cause of death worldwide. Worldwide, and heart disease, actually the heart is a very simple organ. Okay, it is just the most important organ in our body. Its main function is to work as a pump. So this is the heart, a model of the heart. Okay, if I turn it around, you can see the 3D version of this heart. The heart in real life is usually over the left hand side of our chest. It is the size of our fist, and but there are people who are born with the heart being on the right hand side, and this is called dextrocardia. The heart is still normal, but it's just over the right hand side. The heart basically works as a pump. So it pumps blood to circulation. It pumps blood out from the left hand side to the circulation through the aorta, and then after which supplying all the body, the whole body, the brain and other organs, with oxygenated blood and nutrient, and after which, okay, it will then collect back blood from the circulation into the right hand side, and from the right hand side goes to the lung to then fill the blood with oxygen that we breathe in and then repeat itself. So the heart actually pumps blood about 4.5 liter per minute. And this heart, you just imagine the heart to be like a water pump, okay? For it to work well, okay? Anatomically, the heart must be in very good condition. So what can actually go wrong with the heart? First, for the heart to function, it must have good blood supply, okay? So it's actually supplied by three major arteries, and these are called coronary arteries. And the first coronary artery supplies to the front of the heart. This is called the left anterior descending artery. This artery comes out from the left side, and the left side has two arteries coming out from the left side, which is to the front and to the back. And to the back is called the left circumflex artery. The right coronary artery has a different, what you call that? It comes out from a different position, and so it is also the major coronary artery. So coronary artery disease actually means that there is some disease in your arteries to your heart. Now this coronary artery disease is the reason why people have heart attacks. Now coronary artery disease actually can be a spectrum of diseases. Means it is still the same disease where there is blockages in your heart vessel, but it can present suddenly or it can present gradually. And coronary artery diseases that present suddenly are due to heart attacks, and the death rate of heart attacks is about 30%. Okay, and 15% of people who have heart attacks do not make it to the hospital in time, and they die on the spot. So we call it sudden death. One of the causes of sudden death is, of course, heart attacks, which is a disease of the coronary artery. So if you dissect the heart, okay, and then you cut it out, you will see that the heart is divided into two. This is the left side and this is the right side. Each side has two rooms. We call it chambers. So the left side has two chambers, the right side has two chambers. So there are four chambers in the heart. And between these chambers are what we call valves. Now valves are like doors. Okay, it can open and it can close. Okay. And when you have valves, of course, there are times when you have valvular heart disease. Valvular heart disease is any diseases pertaining to abnormal valves. You can have abnormal valves, you're born with it. For example, a mitral valve prolapse, where if I were to demonstrate this is a valve, how should I do it? Okay, if this is a valve and it opens and closes, sometimes you're born with a valve leaflet that is slightly lower. And when it's slightly lower, it doesn't meet. So there is a leakage. Okay, so when the valve actually opens, it's fine. But when it closes, it doesn't meet. So there's a leakage, which we call regurgitation. And valvular heart disease can also be due to childhood illnesses like chronic rheumatic heart disease, whereby there's an infection, and the infection is actually due to a sore throat. But because after the infection, the body then produces an antibody and cannot recognize the heart valve, and then attacks the heart valve and then makes it either too tight, means it doesn't open well, means it opens like this, or again becomes loose and it doesn't close well. So chronic rheumatic heart disease is a valvular heart disease. It used to be very common previously, maybe about 30 years ago, because people used to be staying in overcrowded areas, and then they undertreated kids with sore throat, bacterial infection. So you can get valvular heart disease, and sometimes they are missed. You do not know it until much later when they present with other symptoms like that suggest heart failure. Now we have dissected this. So we can have again hypertension, which is also a very common heart disease. Though we call it heart disease, it is not due to the heart. It is actually the hypertension, the blood pressure builds up in the blood vessels to the body. Okay, and this is because the blood vessel wall becomes very rigid. And a lot of times people think that high blood pressure is related to age. It's true, it is related to age, but it is not acceptable. It needs to be treated. And all high blood pressure, when treated, will reduce the risk of stroke, will reduce the risk of heart failure, and will reduce the risk of renal failure. We won't talk so much into, speak so much into the treatment of hypertension and common heart diseases today. I just want the talk to be short for you to understand what kind of heart diseases do we have. Okay, so because the heart is actually made of muscle, okay, means the heart walls are all muscle. Okay, now only muscle can move. So obviously, for the heart to work as a pump, it must be a muscular organ. So the muscle can also be diseased either genetically, where it is thickened, so there's hypertrophic cardiomyopathy, or during a viral infection where the heart muscle is infected by the virus or sometimes the bacteria, and then the heart muscle becomes weak. Sometimes this is a very deadly disease because it is sudden, and then suddenly your heart fails, and then there's no treatment for it. One of my friends actually died from viral myocarditis. Now, heart failure, it is, as you know, heart pumps. Okay, so heart failure is something that a disease that may come secondary to other diseases. For example, if you have coronary artery disease and you have a heart attack, when you have a heart attack, your heart muscle die. So if your heart muscle die, then a large segment of your heart will not be able to pump. And if it doesn't move the heart muscle, then your heart becomes weak, and you will present with what we call heart failure. Means, for example, if your heart is pumping very strong, okay, when your heart muscle dies, a certain part doesn't move, only this part moves. So your heart will not be able to generate the flow, okay, to the circulation, and you will get heart failure. Okay. Then you can also have heart problems that is related to the muscle, which there's no reason at all. We call it idiopathic. In idiopathic dilated cardiomyopathy, your heart actually gets dilated, okay? And we will never find out why, okay? And because it just comes suddenly. Even in pregnancy, some women actually get heart muscle disease, okay? We call it peripartum cardiomyopathy. They actually get pregnant and then their heart becomes weak. And these patients would be advised not to get pregnant again because in each pregnancy, the heart will become weaker. And it's always related to pregnancy. It may even, how you call it, get better after the pregnancy is over. But again, when you get pregnant again, the heart will become weaker. I have a question here by Amy. What causes valve aneurysms? No, valve usually there's no, okay, aneurysm is actually, if you imagine the blood vessel to be a pipe, okay, and now I'm always trying to explain to you coronary artery disease is where there is a blockage in the heart vessel. Now, aneurysm is actually where the the blood vessel becomes larger than it is. Okay, it is because the blood vessel wall is not healthy. So when the blood vessel wall is not healthy, it can dilate into what we call like aneurysm. So when Amy asked what causes valve aneurysm, valve in itself doesn't have aneurysm. But sometimes when you have a valve infection, especially in aortic valve infection, okay, because aortic valve is right here and is next to the aorta. So when you have an aortic valve infection, sometimes the valve actually then there is like pus collection accumulate into the aorta wall, and then the aorta wall will become weak and become aneurysmal. The aorta can also become dissected. For example, when you have very high blood pressure, okay, dissection means that the aorta, okay, if the aorta is, let me just show you this, okay, this is, let's say, an aorta, okay, so the blood is flowing through, and this is the aorta wall, okay. So what will happen in the dissection is, okay, there is a tear in the aortic wall, and then when blood is gushing through, it goes into the wall. So if you imagine this, and you imagine now blood vessel, okay, longitudinally, and then so the blood will gush into the break, the tear in the wall, and then it will break up the wall along the aorta, and that's aortic dissection, commonly found in patients with high blood pressure. Now, high blood pressure is a very common disease. We used to think that high blood pressure is related to age, but as we now see more and more patients with metabolic syndrome, means they have obesity, they are very overweight, and then there is a high triglyceride level, or sometimes diabetic, okay, they can also present themselves with high blood pressure. So as I practice over the years, I'm seeing high blood pressure in younger and younger patients these days. It used to be a disease of patients over 45, and 1 in 3 of patients with over 45 will have hypertension. Okay, so now we have settled the aorta, okay, the coronary arteries, of course, and then we have settled that the common heart diseases are like the valve. And as you age, you also will get thickening of the valve, especially aortic sclerosis. Okay. Wow, why is there an angry face there? Okay, and then you get disease of the muscle, okay, causing heart failure. Okay. And you can also get common problems like arrhythmias. Okay, arrhythmias are abnormal rhythms. Now, it is very difficult to demonstrate or impossible to demonstrate to you what arrhythmias are based on this anatomy or this graphic. Because arrhythmia is, oh sorry, arrhythmia is an abnormal heartbeat. It can go very fast or it can go very slow. Any abnormal heartbeat is arrhythmia. And if you imagine, okay, we try again. So if you imagine that this is a wiring system in our heart, okay, and this is a switch, and the switch is called SA node. Now, if you have a switch here, okay, it will generate an electrical impulse, and then it will come to, let's say, the end of the wiring system. It is when your heart will then pump once. If you generate, your heartbeat is 60 times per minute, means this switch, which is the SA node, has generated 60 beats per minute, transmitting electrical impulse from here to the end of the wire in your heart 60 times. Now that is a normal heartbeat. Any heartbeat that is abnormal, be it an extra heartbeat, means your heart can have a wiring system, but the muscle sometimes can give extra beats, okay, and it can be a ventricular extra beat, okay, means it comes from this chamber, okay, and with that, you get sometimes palpitation, and you have ectopics, okay, and these ectopics are very common. They are not life-threatening. They are very common. They can present with palpitation, and sometimes they can also present with cough when you get the palpitation. Okay, and then other arrhythmia includes atrial fibrillation, which is also very common. Okay, which is also not life-threatening. But Amy is asking, what's the difference between sudden death and cardiac arrest? There are many causes of sudden death. Okay. Any death that you die suddenly is sudden death. Okay. For example, if you have a massive bleed in your brain, okay, and then you die. Okay. So it's internal bleeding from your brain and you die, that is sudden death. Okay. Cardiac arrest is a cause of sudden death. So cardiac arrest is when your heart stops. Okay. Of course, it will cause sudden death. There are some abnormal rhythm, arrhythmias, that will also cause sudden death. Okay. Some patients are born genetically prone to abnormal rhythms that are very life-threatening. Okay. I have when I was in university hospital, there was a family of 4 daughters, and 3 of them died in their sleep during their teenage years. Okay, so there's only 1 sister left, and they had the long QT syndrome, whereby they are very prone to abnormal rhythm, life-threatening abnormal rhythm, and when that happens, they will have sudden death. So sudden death is any death that happens suddenly, and cardiac arrest is one of the causes of sudden death. So sometimes abnormal rhythm, okay, are most times not dangerous, but if you have coronary artery disease, means, or you have high blood pressure that's untreated, okay, or you have valvular heart disease, all these diseases in the heart increases your risk for arrhythmias, means increases your risk for abnormal rhythm. Okay, and it can be, the abnormal rhythm can come and go. Okay, sometimes you feel fine, and then sometimes you don't. Okay, it doesn't mean that the palpitation or abnormal rhythm will stay there forever. Okay. But the longer you leave it, like atrial fibrillation, the longer you leave it, the longer it will stay there, and the harder it is for us to revert it back to normal rhythm. I'm not going to speak too long because I'm really exhausted. But if you do have any questions, okay, please think about it, because I will ask you to post your questions, and then next week we will have a Q&A, again based on common heart diseases. We will go more in depth about the treatment, and maybe answer all your questions for next week's session. But this week we just make you understand what is actually. So we shall recap. This is the heart. The heart works as a pump. Okay, for it to work well, you need blood supply, and there are three major blood vessels, okay, to the heart for it to function well, and they are called the coronary artery. So coronary artery disease is the main killer because it causes heart attacks. And if you look at the aorta, the most common cause that is related to arteries is hypertension. And you know hypertension very well. I'm sure you know people with hypertension. And of course, you have diseases of the aorta, which, like Amy asked about aneurysm, and then dissection, where there's a tear in the blood vessel wall. And again, dissection is related most commonly in patients with hypertension. And if we dissect and look anatomically at the heart, there's valves, so there's valvular heart diseases. Okay, there's the whole heart is made of muscle, so something may go wrong with how the heart function. Means the muscle is either not functioning well from a viral infection to maybe a heart attack due to dead muscle, or even genetically your heart muscles are born abnormally. Okay, and then of course there are arrhythmias that I cannot demonstrate here. Okay, arrhythmias are abnormal rhythm. So these are basically the common heart diseases. Because the heart is so simple, it is not like our brain. So that's why it is so easy to become a cardiologist, because it is an organ that is completely simple. Okay, just think of it as a pump. Okay, pumping blood to the circulation, collecting blood from the circulation when we are depleted of oxygen, and then sending it back to the lungs, and the lungs where we breathe oxygen, the blood will actually collect the oxygen and then circulate to the body again. Okay. Any more questions? I'll take questions next week. Maybe 2 days before the live chat, I will post and collect all the questions, and then next week we will go through all the questions. And somebody who got very angry with my update, can you explain why? Bye.